Finally, I bring you the last lap in the mental health series we started 3 weeks ago. Thanks to Dr. Maimuna Kajeri, the celebrity shrink who has been on this trip with us. And many thanks to you, yes, you, also for staying true to Congo TV. Now, let's have a quick recap of what we've touched on so far on mental health issue. Last week, we were able to extensively speak on what roles family dynamics play on mental health, stages to complete mental breakdown, and workplace responsibilities, among others. So today, still with Dr. Kajeri, we'll be examining, among other things, the impact of social media and technology on mental health. We'll also be talking about available support networks. How can the mental care system, particularly in Nigeria, be improved? And how to deal with stigma issues. Welcome and relax as I take you through this fresh set of education. I am Bumi Idowu. Now let's go straight to the questions. We believe in medical parlance that, prevention is better than cure. So I want to ask, what role does early intervention play, in preventing mental health issues from escalating?
Exactly. So early intervention is always important for better outcomes. In as much as prevention is better than cure, when you intervene early, it will reduce the severity of the mental illness. It would improve the outcome. It would ensure that it doesn't become, you don't move from symptoms that are mild to severe symptoms. And it will also reduce the costs. Because when it becomes severe, you may need medication, you may need admission, you may have to take medication for a very long time. It will reduce the cost. It will also keep you in that space where you understand that things, because we are intervening early, it will not make you to get into a space where you may lose your identity, you may lose your job, you may lose your relationship. It may make you unproductive. It may make your personal hygiene to decline. So you see where that early intervention is very key. You cannot, if you escape the preventive aspect, or even if you did everything preventive, but because you have in your DNA that there's a possibility you will have a mental illness, now you know. When you intervene immediately, seek for professional help, get help, reach out for therapy, go for evaluation, the severity, improve outcome, those are the things. And of course, reduce costs.
Great. So would you say Nigeria actually has good mental health care system? Or if not, how do you think the one that's presently existing in Nigeria can be improved on?
If you had asked me this question last 2 years, we're still grumbling with the fact that we do not have a mental health act. But sometime before the last administration handed over the baton, they passed the mental health bill into an act. Yeah, that means the mental health of Nigerians have now been prioritized. It means that it's not important and it's not a priority. Yes, but we all have a lot of policies that are just there. Our biggest problem has always been implementation and execution. So we also now have the Mental Health Act. And we are hoping and we are currently working to ensure that implementation and execution is very key. So how can we make mental health care in Nigeria better? You and I, we have malaria, we run to LASUT, Lagos State University Teaching Hospital, or LUT, Lagos University Teaching Hospital. These are tertiary organizations. You do not need to. We need to start from the grassroots, primary healthcare centers. We have over 30,000 primary healthcare centers in Nigeria. But what is the idea of when you think about primary healthcare center? Goats and sheep and dogs that sleep there. They are debilitated. No. So we must integrate mental health care into our primary health care services centers. Why? Because the individual that has left Ikate area of Lagos State to Psychiatric Hospital Yaba will still come back to Ikate. It's
That's
not going
right.
to live in Yaba. So
No.
that is why we must integrate it into primary health care services. We must increase funding to mental health care. The Abuja Declaration of 2001 stated that, which was all the 54 African countries, that 15% should be allotted to healthcare. Trust me, Nigerians, we haven't got it to 10%. And what comes to mental health is infinitesimal. Even in this current dispensation in 2024, 50% is no longer enough. So we need funding in health generally, and of course in mental health. We need more public enlightenment, more public education, more advocacy to reduce the stigma, discrimination attached to mental health and people living with mental illnesses, including their families. We need mental health to be incorporated into our school curriculums. We have social studies, they'll put mental health like one page there. No, we need a practical way, age-appropriate way of teaching mental health in school. Starting with self-esteem, resilience building, emotional intelligence. That is all the whole spectrum of mental wellness. So we need that. So inclusive in our primary healthcare services, and of course having policies and frameworks that can help. Look at Nigeria, we still have suicide being a misdemeanor. So if you attempt to kill yourself, you should go to jail for 1 year. That shouldn't be. Somebody that's already dealing with a mental illness, why? So of course, we are working in ensuring that that is expunged, but we also believe that when we have the right policies and frameworks, it will help us to have a better mental health care sector for any individual, because nobody, absolutely, including myself being a psychiatrist, I'm not immune to having a mental illness. I'm not. It's not me being aware of my triggers, my strength, my weaknesses. And if for any reason I break down, early intervention, ability to seek for help when and if I need it. So yes, we are still a work in progress when it comes to mental health care service in Nigeria.
Thank you, Doctor. We'll quickly go on a break. We'll be right back.
I am the life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only, I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party.
Welcome back and thanks for staying tuned. So, Dr. May, would you tell us what are some support networks that are presently available for individuals experiencing mental health challenges in Nigeria?
Great question. What are those supports? Online, offline, private, public?
Absolutely.
Community, and it starts from the home. But again, I also tell people, let's even start from you, being aware of what is available to you when and if you need it. Online, there are so many platforms that are there, a peer support group, a website that have a lot of resources that you can download. And the thing is that just being aware can save you a whole lot more. Then, of course, we have offline hospitals, whether private or public hospitals where people can go to and assess. Because when you decide to do your health check for the year, don't just do your blood, go for CT scan, chest X-ray. No. If mental health is not included there, ask them, I need to be evaluated for anxiety, for depression, for drug use. Because sometimes you may think that you are not obviously smoking or taking alcohol or taking any other psychoactive substance like marijuana. Who said the food you are taking? Some of the condiments there might have been laced. and you never can tell. So it's very, very important. And that was what led us to our first movie production, Pepper Soup, in 2017. This boy was just taking pepper soup, thinking it's just normal pepper soup. Didn't know that the person who was selling the pepper soup scent leaf they put. The woman didn't used to put it. Rather, she was putting marijuana leaves.
Wow.
And that was how I became addicted. So things can happen. So you may be sure of yourself, but you may not be sure of where you eat and access to other things that can affect your mental. So online, offline, private organization, hospitals, public organization, helplines are also there. For us at Pinnacle Medical Services, we have a helpline, Speak Out, or 0800 Speak Out, and I would always encourage people to call in. Before COVID, we had a walk-in every Friday, but after COVID, we kind of took it off because we are overwhelmed. We are trying to reinstate it back. We have a telemedicine platform, HeartBody. So please go on Google Play Store, Apple Play Store, HeartBody. The way we call it, HeartBody, how are you, is right there. It's a telemedicine platform. They have loads and loads of resources there. Just check. Are you even sleeping where you see it there? I check whether you have depression. Check whether you have anxiety, whether you are abusing any drug, whether you are addicted. Is right there. And we have trackers to track your mood, track your anxiety, track your awareness. For women, even your menstrual flow. So these are free resources that are out there. And when you check, they will give you instant results, answers. And if you want to talk to a therapist, there's also a click that you can log in or schedule an appointment to speak to a therapist. So resources are here locally and internationally. So please, let's indulge ourselves and immerse ourselves in getting this right information to help, promote our mental well-being.
Thank you for that, doctor. Now, they say a problem is half solved if it is admitted. But we have some people who have issues in seeking professional help. What advice would you give to such people? People who are hesitant to seek professional help. They don't want to admit it.
Yeah. So we have those kind of people. Some people do not just want to seek for professional help, despite the fact that they know that they are having. Some people know, let us say, they may not know. So they have this group of people. Now you're saying they know, but they don't want to seek for. So they are in denial and they do not want to seek for. So for my advice for those kind of people, for me, what do I want to tell that kind of a person? I want to tell the person the benefits of being mentally healthy and stable. Let the person understand what it will bring, rather than like, if you like, don't go and seek for help. When you enter street, that is your business. So you are -1. There are 3 of you still remaining. Parents can do that. If you like, don't go and do so. I have 4 of you. That is your business. I still have 3 healthy children. And our family members will cancel you out.
Yeah.
So you encourage that person to speak to a trusted family member, a mentor, a religious leader that he or she, has respect for. Let's even start from it, because sometimes when you force them, it may not work. And we are hoping that those people that they are speaking with, they are not professionals, but they listen to them non-judgmentally and help direct them to go seek for help. So you see the beauty of how this thing works. So they are the ones that we encourage. Or you can even tell the person, go see your family healthcare physician. Doctors, when you come in and they know that you have that issue, they will refer you to the expert that will help you. But again, on my side, I'll say, those kind of people that know they have issues and they don't want to seek for help, let them start with self-care tips. What are those things that can help them personally? Because not everybody that will need professional therapy, medication, admission. So what are those self-care tips? Exercise. 30 to 45 minutes brisk walk has been known to help release endorphins that can manage anxiety, fear, and even mild cases of depression. Eating right, ensuring your plate is rainbow color, not just white and red like rice. No. Eating right, fruits and vegetables in the season, not only help you to stay healthy, but also boost immunity. Sleeping, Lagosians, I need to scream this one and hold my ear. Oh, they don't, if I sleep, I'm sleeping my destiny away. You need 7 to 9 hours of sleep. It is what it is. Sleep well so that your body can recalibrate. It is very important for you to ensure that you sleep well. Then manage your stressors well. Because when the reason why you are dealing with what you are dealing may be just because you are having some stressors and you are not able to manage them well. So those are some of the self-care tips that I would strongly recommend. Limit exposure to news and social media. Exit that WhatsApp group that is not helping you. Have a social media detox. So those are some of the self-care, but I strongly believe if there's something you notice there's a change that wasn't there yesterday that you notice today and can escalate if you don't take the necessary steps, seek for help. It's a sign of strength and never a sign of weakness.
Oh, thank you, Doctor. You just touched on what I wanted to ask next. So I'm going to go, bypass that. I wanted to ask this technological age, what do you think the impact of technology is on mental health? But you already touched on that. So I just want to now ask, so how do you think people suffering from this denial, how can they be helped? They don't want to help themselves. How can they be helped?
Dealing with social media issues or
yes,
just generally?
Both of them together. Those ones, there are some people that are so addicted to social media, and there are some people who are living in denial that, they know that they have these challenges, but they're refusing to get help. So how can such set of people be helped?
So those people, right, I have some steps I've always said that we can use to help those individuals. Platforms like this promoting mental wellness, mental well-being. So this person is refusing to take the necessary steps, and how can you help? So for social media issues, please, we must be very intentional and deliberate to set social media timeout, detox, go off 1 week, 2 weeks, and follow through. Embrace the joy of missing out, JOMO, and resist the fear of missing out, the FOMO syndrome. That is what is killing a lot of us. Oh, if I go on social media, I don't know what is happening. Are you an eyewitness reporter? Must you break the news? Because if it's not good for you, it's not good for you. So social media detox is a good way. If you find yourself, because anybody can be addicted to anything. As basic as caffeine, you can be addicted.
That's right.
If you find yourself addicted, go get help. There are therapies, there are rehabilitations that can easily help you. Then, of course, self-care tips are very, very important. Very, very important. Like all the things I said earlier on, sleeping adequately 7 to 9 hours, exercise 30 to 45 minutes, at least 3 to 5 times in the week, eating healthily, doing medical checks-up, managing your stressors, having a healthy support system. Don't live in isolation. Loneliness is not the same as solitude. Loneliness is not a global health crisis. In fact, if you have issues with loneliness, it's equivalent to somebody who smokes 15 cigarettes per day.
Interesting.
It is not bad. So please seek for help when you need help. There are options of managing mental illness. It doesn't have to be medication. It can start from talk therapy, psychotherapy. If you need medication, get medication. Most of the medications are not for life. And get yourself help when and if you need help. They are manageable, they are treatable and beatable, just like any other medical condition.
Thank you so much, Doctor. Now, the last but not the least, going by the alarming statistics known, how can persons break from stigmatization? In Nigeria, we're so used to stigmatizing people. How can people having mental disorder break from this stigmatization?
Stigma is such a big issue, and it's not a Nigerian problem only, it's a global issue. But again, let's bring it back home. Stigma, we have started talking about mental health, and it's a good thing. But are we there yet? No, it's a work in progress. We are beginning to see people being bold to say, I'm dealing with mental health related issues. But the thing is that we need to do much more. So public enlightenment, public education, advocacy, walking the talk, ensuring we have curriculums embedded into our school system. Workplaces should have policies whereby they would encourage employees to go get help. So by having employee assistance program in the workplace, a very beautiful way to help employees deal with their mental health related issues. then we need mental health ambassadors. We need more people that have influence, like celebrities, talk and share their stories. Because if I love you so much and I'm following you as a musician, you have 30 million followers. Imagine you being vulnerable enough to say, I'm dealing with this whole thing. And we being there to support that individual. Not everybody will, but when they share their stories, people will know that they are also humans too. And that also kind of, it makes it very relatable to say that anybody can have a mental illness. Nobody has that immunity to having, so saying that I'm not going to have mental illness. Then let's normalize mental health conversations. My mantra is normalizing mental health conversation by building a culture of compassion. When we normalize mental health conversation, the way we talk about malaria, hypertension, diabetes, it creates a culture of compassion where people can easily speak up and speak out. And then we can encourage help-seeking behavior. So these are some of the ways that we can, reduce stigma, discrimination attached to mental health, people living with mental illnesses, including their families.
Thank you so much, most sincerely, Dr. May Yusuf Kadiri, for joining me on this edition. It's been incisive, educative, it's been great, it's been enlightening. And I must say thank you for sharing your time and your words of knowledge with us. Thank you so much. And I hope when I call on you again, you will oblige us.
Thank you very much.
Thank you, Doctor.
And to everybody out there, know that health is wealth, and there is no health without mental health. So make sure you schedule twice a year to go get mental health assessment. Get evaluated for as common as anxiety and depression. And if for any reason there's that change that you are noticing today that wasn't there yesterday, please get that help. I do not want you to only survive, but I want you to also thrive and flourish. You deserve better. Life is to be enjoyed, not endured.
It's been 3 weeks of enlightenment on mental health. Hope you jealously guard yours, as the saying goes. Taking care of your mental health is an act of self-love. If you don't love yourself, who will? So thanks a great deal for being part of this show since the beginning up until now. Should you want to contact us for comments, questions, or sponsorship inquiries, please do not hesitate to call on the numbers scrolling or send a mail to info@congotv.com. Until next time, think health matters. Think Talking Health with Bumi. Bye for now.